Right, so we were talking about the dying process. I think I was talking about morphine and medications that we might give someone to ease the process of dying because it is very uncomfortable, to say the least. So morphine is something that we give people to take away their pain, but also to ease that air hunger. You know, that because as their respiratory system starts shutting down and they're not breathing, that can lead to that Cheyne-Stokes respirations, and it's very uncomfortable. So morphine takes away air hunger, and that's why we like to use that. As the urinary system shuts down, people become incontinent. They become incontinent of stool when their digestive system shuts down. As their kidneys shut down, they're going to stop producing urine. They're going to start building toxins up in their blood, so they might become confused. Don't be surprised when people start hallucinating. They'll start seeing people who have died. They might see their mother or their father or, grandmother. And usually when people start saying things like that, we can tell them, it's okay for you to go to them. They become restless sometimes just because of how uncomfortable it can be. Anorexia just means loss of appetite. So, as your digestive system shuts down, you don't have an appetite anymore, and that's expected and normal. Sometimes families don't understand that, so they try to force feed people because they think that they're starving, but that's just going to make them sick. If your digestive tract's not working and you keep feeding someone, they're going to throw up, and now you've just made them even more uncomfortable. So as death approaches, your responsibility as a CNA will be to assist with their activities of daily living if they're still eating, helping them with that. And if people are dying, we know that they're dying, we usually let them have whatever they want, whatever dietary restrictions they were on before, we take them away. We've even in the hospital sometimes gone out and got somebody a beer because that's all they wanted was just a beer. And we can do that. It's obviously not going to change anything at this point if they have that chocolate donut and they have diabetes. We really don't care what their blood sugar is going to be. We want to make sure that they're comfortable and happy as they're dying. We want them to have a death that's dignified. So keep them covered if they're cold, if they're sweating, keep them clean and dry. I mean, these are things that we should be doing anyway. A lot of what you're going to be doing is providing emotional support. So think about that family, if they have a loved one that's dying, they probably don't want to leave that person. So even just bringing them a cup of coffee or telling them, I'll sit with them while you go take a walk or go get something to eat, that really means a lot to people. So take care of their needs as well. Obviously, hygiene. Still want to make sure this person's clean and dry and feeling good. Nobody feels good when they're dirty. Think about the environment around that person. One time we went into clinical and a lady was dying and she had some loud talk show on. It was really bright in the room. It was just not an environment that you would want to die in. So we noticed she had some rosary beads, so we put on the Catholic channel for her and turned the lights down. And, just some peaceful music in the background. This should be as nice of an experience as it can be. I mean, death is never going to be a great experience, but you can really have an effect here on the kind of death that somebody has. So letting them have privacy, being respectful, those things are so important. And anything that you can do to make that person more comfortable, you should be doing it. If their back is hurting, give them a back rub. Don't be afraid of somebody who's dying. Sometimes, again, if people have certain religious beliefs, they might want a pastor or a rabbi or a priest in the room with them. They might want to do, I think it's called blessings of the sick or something. It used to be called last rites. So those things become very important to people. You need to find out, what they believe and who they want in the room with them. Some people do not want any clergy in the room with them. So make sure you know that too. You should not assume that that's something that everyone would want. So the best thing you can do is just be there. Be there for that person. Sit with them. Think about all those therapeutic communication techniques that we talked about. You know, not saying everything's going to be okay, everything happens for a reason. Those things are not helpful in this situation. The only thing you can say is, I'm sorry and I'm here for you. When someone dies, all of their muscles are going to relax. So their jaw may drop, their eyes may be opened, the body's going to become very, very cold. And as those muscles relax, obviously they're going to become incontinent of whatever was inside. So all the stool's going to come out, urine, they're going to be soiled. They're going to become very cyanotic, sometimes almost purple. The blood's going to settle. So if they're out for a long time before you put them in the morgue, they're going to have bruising. It almost looks like bruising, but it's just the blood settling. And over time, if they're not put into the morgue where they can be cooled, they're going to go into rigor mortis, where everything stiffens up. So you need to put them in a good position before they go into rigor mortis, because whatever position they're in when they go into rigor mortis, they will stay in that position. So as a CNA, you would be responsible for doing post-mortem care, and the process for that is in your book. You would clean the body, dress it in a gown, and then, you know, it depends on which funeral. If the funeral's coming to pick them up right away, or if the facility has a morgue, you would need to follow a facility protocol for that. So we just talked about this, following facility protocols and policies. Please be respectful during this process. Sometimes in healthcare we use humor as a way to cope, but this is a human being, so this is not a time to be joking around. And I've seen some very inappropriate behaviors when it comes to death and dying, and that's not who you want to be, because that's not how you would want your loved one treated. If family is coming into the room to visit that person, you want to make sure that that body looks good. All right, so we will clean it up. You know, if there's vomit on the face, clean that up. Try to make them look as pretty as you can for the family that's coming to visit, because that's going to be their last image of the person that they love. Now, if this is a medical examiner case, which sometimes happens, especially in the hospital, where we're not exactly sure why they died, or, you know, the death was suspicious, then the medical examiner may need to come in and do an investigation. In that case, we cannot clean the body up. We cannot remove any tubes. We have to leave it as it is until the medical examiner gets there. So that is something very important that you would want to check before you start cleaning this person up. I remember we had a drowning victim one time that was a medical examiner case, and all we did was wipe the sand off of her, and they were furious about that. So don't touch it. Don't touch the body until it's been cleared by the medical examiner, if it is a medical examiner case. So if the family is going to view the body there, you know, be respectful, make sure that it's private, give them tissues, I mean, just common sense stuff, have a place for them to sit down. If they want you there, then be there as a support. If not, give them privacy. So every facility is going to have some type of post-mortem kit. It's going to be different wherever you go. So the procedure for this, again, is in your book, but these are some of the things that you'll see. There's always going to be tags in there. The tag will go on the big toe. Should have their name, their date of birth, you know, medical record number, stuff like that. And then if they had some kind of infectious disease, it should be on that tag too, so that the funeral home or wherever they go knows that, you know, that this might be an infected body. There'd be a plastic bag for personal belongings. Anything valuable should really go to the family if they are there. You know, I wouldn't want to put any kind of jewelry inside of one of those plastic bags because it could get lost or stolen. So we usually tie the chin in place, because if the jaw drops and we don't put it back up, then when that person goes into rigor mortis, then they have to break the jaw when they go to the funeral home. So, you know, close the eyes because they will dry out. We tie the hands together and the feet together. And then we put them in some type of shroud. Sometimes, you know, it's just a big tarp that we have to wrap around the person and tie together. And sometimes it's a zippered bag that we put the body in. So I'm sure you can imagine there are a lot of legal issues surrounding death and dying. Any kind of risky procedure should always have informed consent in case that person does die during the procedure. Then that we can show that this person was aware that that was a risk. Some people have living wills which say what they would want done in case of emergency. Some people, you will find a lot of people in long-term care are DNRs where they are do not resuscitate, meaning if they die, there are no heroic measures. We do not do CPR, we do not intubate them, we don't do anything, we just let them die. And that's what people want, so we respect that. If somebody cannot make these decisions on their own, they might have a durable power of attorney for their health care. It's usually a family member, like a son or a daughter. So if somebody has advanced dementia and they can't make those decisions, then we would go to the next of kin if they don't have that durable power of attorney. So that concludes it. I still would want you guys to read these 2 chapters in your book for more understanding, and make sure that you do your workbook. If you have any questions, of course I am available. So just let me know. Thank you.